Hello everyone, my name is Marina Gadal Sayed, and today I would like to take a closer look with you into the present HIV health disparities and support in the Coachella Valley community. We'll be going through the following bullet points right here, so let's get started. First of all, I want to explain why I chose the Coachella Valley community. This community is riddled like a landmine with health disparities for several illnesses, and the population there has very low awareness of HIV. It is actually one of California's largest produce outlets, yet is also the largest producer of environmental injustice, health inequity, and the lack of HIV-related resources. As a matter of fact, it took about 7 years since the discovery and discourse about HIV in the United States for the first testing, treatment, and prevention clinic to be established in the Coachella Valley by 1988. This clinic was established by the Desert AIDS Project, or DAP, which actually made amazing progress in establishing a foundation for AIDS support in the Coachella Valley. DAP then recruited 250 physicians for studying and treating HIV in that community by the year 2000. This, of course, meant being the community's first experts to inform about and administer PrEP and PEP. They also established the first annual Desert AIDS Walk by 1989 to spread awareness and raise funds for the cause. Next, I will be discussing the HIV and Aging Research Project, established in 2015. HARP has done amazing work in terms of studies, projects, and clinical trials. Their work helped explore new therapies for HIV as well as educate the community and reduce HIV stigma. HARP has dedicated a lot of effort into researching about women and HIV, and more recently about how COVID-19 affects HIV patients' physical and mental health. Now I'd like to introduce the Patient-Centered Outcomes Research Institute, or PCORI. PCORI is an institute that does exactly what's in the name. It helps patients make better informed healthcare decisions and continues researching new therapies to ease disease progression. Here are just some of the most prominent research studies and projects that PCORI has done in the Coachella Valley. These include everything from clinical trials to demographic observational studies and mental health research. Lastly, I want to discuss some of the results of a paper recently published by our very own Dr. Brandon Brown. It is titled Indicators of Self-Reported Human Immunodeficiency Virus Risk and Differences in Willingness to Get Tested by Age and Ethnicity, an observational study. The results of this study are shown here, but in a nutshell, a large percentage of Coachella Valley residents did not receive testing for HIV, either because they don't perceive they're at risk for it, or because they were never offered to test in particular by a healthcare provider. The Hispanic population is about 10% less likely to test than the rest of the population according to this study, and people over the age of 50 are actually 20% less likely to test for HIV compared to other age groups. This large difference in testing habits and demographics of people getting tested leads us to wonder what else needs to be done in that community. There are two main steps that need to be taken, both to protect the community from HIV and help Coachella Valley residents who are already positive for HIV. Number one is community education, which can be done through better physician-patient communication, increased social media awareness, and continued research about patient demographics. Number two is resource allocation, and this can be done through government aid, both in bringing physicians, researchers, and experts into the area and providing funds through which progress can be made. These funds, of course, must be dedicated to expanding clinical trials and researching new therapies for HIV, in addition to providing HIV treatment at a lower cost for HIV-positive residents of the Coachella Valley. With that, I would like to thank you all for your time. Together, we can make HIV outcomes better in the Coachella Valley, but it truly takes a village to holistically approach this from all angles of demographics research, patient monitoring, clinical trials, and community education. My references can be found in the next few slides for your convenience. Thank you very much.